My name is Mélodie Bernaux. I'm a policy officer, a second national expert in the digital health unit of DG Santé. My background is that I'm a medical doctor involved in public health and a good knowledge of secondary use of health data. I will be speaking about EHDS, the ELSI event. I will be talking EHDS from vision to reality. And that's because we are moving forward with the implementation. The EHDS is no longer just a vision, it is now taking shape. As you may know, the regulation was adopted in March 2025, and it was published in the official journal, and it has entered into force, and we are now preparing the implementing acts to operationalize the key provisions under both primary use and secondary use. For secondary use, which is where my focus is, work is progressing smoothly. We are building with the member states the Health Data at EU infrastructure. This will be the backbone enabling cross-border access to health data for research, innovation, and policy making. We are building the catalog in the different member states of the different datasets that are available, and we're also shaping the governance. So on one side, what could become the steering groups of the infrastructure. For primary use, we are scaling up the MyHealth@EU infrastructure in order to expanding it to new data types and in order to connect the member states. So the Commission and the Member States are working jointly through different actions, first through the Regulatory Committee, which will adopt the implementing acts, but also through a number of supporting actions, such as the joint actions, where Member States are shaping guidelines and technical specifications, and also in the eHealth network and in the community of practice, both focusing on establishing the national systems and the cross-border system for all those data users. And we plan to go live for most of the provisions in March 2029. In parallel, we have other initiatives such as the 1 Million Genome Initiative, which will be here focused more on genetic data. And we have a number of other initiatives. We also have the EOSC initiatives, the data space for research. EHDS is designed as an enabler. It's the only data spaces with a legal framework, so it provides the legal and the technical foundation to make data available. And it also provides the backbone to share the data from initiatives which are highly specialized, like UNCAN, like GDI or 1 Million Genome, and it will allow to make those data findable, accessible, and reusable across all Europe. So this is really our next step now, after shaping up all those initiatives in the previous mandate of the Commission, establishing the European Health Data Space on the other hand. We will now connect the dots between the different activities. So we are definitely focused on this, and as you may know, there's also the data union strategy that is currently being reshaped and implemented in Europe. The EHDS, it's no longer a project, it's no longer an abstract regulation. I think it's a collective European project to turn health data into trusted public good. It's not data for data. We are implementing something which will fuel some other projects of this mandate, such as the Apply AI strategy, because we know that healthcare and European healthcare in particular needs to get on the train of AI. But it's not just for doing AI for its own sake, In the end, the only thing that matters is that we have better health outcomes for the European citizens. And so, yes, the focus is on implementation, the focus is on trust, and the focus is on impact. And I really hope that in 10 years from now, we will have forgotten about the European Health Data Space, because we will use it every day like we use internet, but we will not speak about it. So that's our mission, to make EHDS simple, accessible, and trustworthy for the European citizens and for the healthcare professionals and the researchers.